I will talk about the 7 signs that appear on your body which may indicate that your heart is not functioning at 100%. We know that cardiovascular disease is the #1 cause of death in USA and around the world. Here in our country, heart disease claims the lives of around 400,000 Brazilians every year, according to the Brazilian Society of Cardiology. Therefore, it is crucial to stay alert. I will divide this video into 3 parts. In the first part, I will discuss the 7 signs you can observe that indicate something might be wrong. It's important to know what to pay attention to when looking for heart problems. In the second part, I will talk about the 7 classic symptoms, which are what you feel when your heart is not doing well. Could you or someone in your family be experiencing these symptoms? And in the final part, I will provide valuable tips to help you avoid heart problems in the future. This will be a very comprehensive video, so stay until the end. I am sure there is a lot you have never heard of before. But first, please like the video, because the more people like it, the more YouTube will distribute it to those who don't have access to doctors or hospitals. Also, share it with your friends and family. Many lives can be saved with your help. So, please share. And tell me, do you have a heart problem or think you might have one? From which part of Brazil or the world are you? Write it down in the comments. 7 signs and symptoms of heart problems. Let's go. What are the 7 signs you should pay attention to that might indicate you have a heart problem? 7th sign, Frank's sign. From today on, you will start looking at people's ears more carefully. There is a small sign on the ear that can indicate blockages in the heart arteries, coronaries, or carotid arteries. In the 1970s, Dr. Sanders Frank noticed that many of his patients with angina, chest pain, had a diagonal crease on their earlobe. He described this as Frank's sign. Among 100 people with this crease, 30 have nothing, being just a mark of aging, but 70 have obstructions. The younger the person with this sign, the greater the chance of it being a coronary or carotid obstruction. It is important to note that while the presence of Frank's sign can be alarming, it should be considered along with other risk factors and symptoms before drawing any conclusions. Regular checkups and discussing these signs with your doctor can help in early diagnosis and treatment. 6th sign, hair loss on the legs. Hair loss, first on the shins and then on the thighs, can indicate peripheral arterial disease, which means blockages in the leg arteries. This can imply blockages in other arteries in the body, including the coronary arteries. Hair follicles need nutrients to grow hair, and poor circulation can lead to hair loss. The skin may become smoother and shinier, cooler, and nail growth may slow. Hair loss can also occur for other reasons, such as genetics or friction from clothing. Additionally, hair loss on the legs is a frequently overlooked sign but can be an important indicator of broader cardiovascular issues, requiring medical attention for a full assessment. Maintaining a healthy lifestyle and proper vascular health can prevent and manage this condition. 5th sign, xanthelasma. Have you ever seen a yellow plaque on someone's eyelid? This is called xanthelasma. It is a cholesterol deposit in the skin, generally aesthetic, but it can indicate dyslipidemia, high cholesterol or triglycerides. About 50% of people with xanthelasma have dyslipidemia, and having xanthelasma increases the risk of heart disease, heart attack, and stroke. While xanthelasma is often considered a cosmetic issue, it can be a crucial indicator of underlying health problems, particularly related to lipid metabolism. Thus, identifying xanthelasma means it's essential to have a blood test to check cholesterol and triglyceride levels and take necessary measures to control them. Regular monitoring and a heart-healthy diet are vital for prevention and management. 4th sign, arcus senilis. Arcus senilis is a cholesterol deposit on the edge of the cornea, visible as a white or gray ring. It is more common in older people, but if it occurs before the age of 45, it may indicate severe dyslipidemia. In older adults, it is normal and does not affect vision. However, the presence of arcus senilis in younger people is a sign that should not be ignored, as it can indicate a high risk of cardiovascular diseases. It is essential for individuals with this sign to have a detailed assessment of their blood lipid levels and to adopt lifestyle and dietary changes to reduce the risk of heart complications. Regular eye exams and cardiovascular screenings can help detect and manage these risks early. Third sign, cyanosis. Cyanosis is a bluish or purplish discoloration of the skin, indicating that part of the body is not receiving adequately oxygenated blood. It can be caused by heart or lung problems. If accompanied by shortness of breath, it can indicate heart failure or other serious conditions. Cyanosis can occur in various parts of the body, such as lips, fingers, and extremities, and is a sign that something is compromising proper blood circulation. The presence of cyanosis should prompt immediate medical investigation to determine the underlying cause and start appropriate treatment. Ensuring proper oxygenation and addressing the root cause can prevent further health complications. Second sign, ulcers. Ulcers that do not heal on the legs or feet can indicate poor circulation due to arterial obstruction. They are usually painful and appear on the outer leg and heels. Venous ulcers, related to varicose veins or venous thrombosis, can also occur and bleed more easily. Arterial ulcers usually indicate a serious circulation problem that can lead to more severe complications if not treated. The presence of these ulcers requires a detailed medical evaluation and may require interventions such as diet changes, exercise, and, in severe cases, surgical procedures to restore proper circulation. Proper wound care and vascular health management are critical to healing and preventing recurrence. First sign, swelling in the legs. Swelling in the legs, ankles, and feet can be caused by a weak or dilated heart, leading to fluid retention. This may be more noticeable at the end of the day due to gravity. Elevating the legs can reduce swelling. Swelling in the legs can also be a sign of congestive heart failure, a condition where the heart cannot pump blood efficiently. It is essential for anyone experiencing persistent swelling in the extremities to seek medical attention for a full evaluation and to determine the appropriate treatment. Managing fluid retention and underlying heart conditions can improve symptoms and quality of life. 7 symptoms of heart problems. Now, what are the 7 symptoms that may indicate heart problems? First symptom, shortness of breath. Shortness of breath or dyspnea when exerting yourself can be a sign of heart problems. This feeling of disproportionate fatigue to physical effort is often an indicator that the heart is not pumping blood efficiently. Dyspnea can occur during simple activities like climbing stairs or carrying groceries and can worsen over time. It is important to pay attention to these signs and seek medical advice to determine the underlying cause and start the appropriate treatment. Breathing exercises and cardiovascular conditioning can also help manage symptoms. Second symptom, persistent cough. A persistent cough with white or pink phlegm can indicate fluid in the lungs. This condition, known as pulmonary edema, occurs when the heart cannot pump blood efficiently, causing fluid to accumulate in the lung alveoli. If you have a persistent cough, especially if accompanied by other symptoms like shortness of breath or swelling in the extremities, it is crucial to seek medical attention for a detailed evaluation. Proper management and medication can alleviate symptoms and improve lung function. Third symptom, shortness of breath when lying down. Shortness of breath when lying down can lead a person to use more pillows or sleep sitting up. This condition is known as orthopnea and is often a sign of heart failure. The person may wake up suffocating during the night, a symptom called paroxysmal nocturnal dyspnea. These symptoms indicate that the heart is not pumping blood efficiently during rest, which can cause fluid accumulation in the lungs. It is essential to seek medical advice if you experience these symptoms. Adjusting sleeping positions and taking prescribed medications can help manage these symptoms. Fourth symptom, generalized weakness. A constant feeling of fatigue and difficulty in performing daily activities can be a sign of heart failure. Weakness occurs because the heart cannot pump enough blood to meet the needs of the body's muscles and tissues. This condition can significantly reduce the quality of life and the ability to perform everyday tasks. Seeking medical advice is crucial to diagnose the cause of the weakness and start the appropriate treatment. Physical therapy and lifestyle changes can help improve strength and endurance. Fifth symptom, nocturia. Waking up several times at night to urinate can be a sign that the heart is not pumping adequately. This condition, known as nocturia, can occur because the body tries to eliminate excess fluid accumulated during the day while you are lying down. Nocturia can be a symptom of heart failure or other medical conditions, and a medical evaluation is necessary to determine the cause and start the appropriate treatment. Managing fluid intake and treating underlying conditions can help reduce nocturia. Sixth symptom, intermittent claudication. Pain in the calves when walking, which improves when you stop, can indicate poor circulation. This condition, known as intermittent claudication, occurs when the arteries in the legs are narrowed or blocked, limiting blood flow during exercise. The pain usually disappears with rest but can return with physical activity. It is a sign that blood is not reaching the leg muscles properly. Seeking medical attention for a detailed evaluation is essential to treat the underlying cause of intermittent claudication. Regular exercise and vascular health management can improve symptoms and circulation. Seventh symptom, chest pain. Chest pain can be a classic sign of heart problems and should not be ignored. Cardiac pain is generally described as discomfort or pressure in the chest that can radiate to the left arm, neck, back, jaw, or stomach. It can be accompanied by sweating, pallor, nausea, and dizziness. If you experience these symptoms, it is crucial to seek immediate medical attention to rule out a heart attack or other serious conditions. Early detection and treatment can prevent severe complications and save lives. How to prevent heart problems? 1. Engage in regular physical exercise. Physical activity improves circulation, strengthens the heart, and promotes mental well-being. Low-impact exercises like walking, cycling, and swimming are great for improving cardiovascular health and overall fitness. 2. Quit smoking. Smoking is one of the worst things you can do for your health. It inflames the arteries, forms fatty plaques, and increases the risk of heart attack, stroke, and dementia. Quitting smoking can significantly improve your heart and overall health. 3. Lose weight if you are overweight. Excess weight puts extra strain on the heart, raises blood pressure, worsens blood sugar levels, and increases inflammation. Maintaining a healthy weight reduces the risk of heart disease and improves overall health. 4. Adopt a healthy diet. Eat plenty of fruits and vegetables, fibers, whole grains, olive oil, and avoid red meat and processed foods. A balanced diet helps keep the heart healthy and reduces the risk of complications. Incorporate heart-healthy foods like nuts, seeds, and fatty fish into your meals. 5. Be aware of family history of heart problems. If close relatives have had heart problems, it is important to have regular checkups and adopt a healthy lifestyle to reduce risks. Discuss your family history with your doctor to determine your risk factors and necessary preventive measures. 6. Monitor cholesterol and triglyceride levels. Eat more oats, cut trans and saturated fats, lose weight, eat more fiber, and exercise. If necessary, take medications prescribed by your doctor to manage cholesterol levels and reduce the risk of heart disease. 7. Keep blood glucose levels under control. If you are diabetic or pre-diabetic, controlling blood glucose levels reduces complications. Aim for an HbA1c level below 7 to manage diabetes effectively and prevent heart problems. 8. Control blood pressure. The goal is to keep blood pressure below 120/80. For some, the goal may be less aggressive, such as not exceeding 140/90. Regular monitoring and lifestyle changes can help manage blood pressure and reduce the risk of heart disease. If you think you have a heart problem, seek medical advice and follow your doctor's instructions. Early detection and treatment can prevent serious complications and improve your quality of life. Did you like the video? Share it so that more people have access to this knowledge. Subscribe to the channel and see you in the next video. Thank you very much.